Hello, Pain Free for Life members. This is Dr. Rob Van Bergen, and I am back with another Monday 10-minute training. Today, we're going to be talking all about sleep apnea, and I'm going to discuss what microcurrent can do to help this condition. First off, for those who don't know, sleep apnea is a fairly common condition in which your breathing stops and sort of restarts many times while you're sleeping. This can prevent your body from getting enough oxygen. Now, there are a fair few types of sleep apnea, but the two main ones that most people focus on are obstructive sleep apnea, or OSA. This is the more common form. This occurs when the throat muscles relax and they essentially block the flow of air into the lungs. The other is central sleep apnea, or CSA. And this occurs when the brain doesn't send the proper signals to the muscles that control breathing. And one can lead to another, right? So you can often start with one and it can change in different things. So symptoms of both of these type of sleep apneas kind of overlap, which makes it really challenging to determine which type you have. The most common symptoms of obstructive and central sleep apneas include loud snoring, episodes in which you stop breathing during sleep. Obviously, that's the main one. This is usually someone else notices that you've stopped breathing, not that you do. Gasping for air during sleep, waking up with a really dry mouth, having a headache in the morning, like a bad headache, difficulty staying asleep. So people can develop insomnia because they're waking up all the time, right? Excessive daytime sleepiness, and this again is because you're not getting enough sleep at night. And difficulty paying attention while awake. You can even be irritability, but that again, I think it all comes down to issues sleeping. So obviously, this can be a very dangerous condition. And I've had a lot of people ask in the past if microcurrent can treat sleep apnea. I've not truly found that microcurrent has been able to resolve sleep apnea completely. I do have a family friend that has sleep apnea, and we've been able to make some progress there, but it's not something that I've seen resolve completely. But I do think there is a lot of promise in reducing the symptoms, and there's certainly something to be said about the direction we could take this and what it could potentially do to actually resolve it. There is a lot of many of you may be familiar with like vagus nerve stimulation and how vagus nerve stimulation was born, right? Vagus nerve stimulation originally came from an experiment on rats, and I'm going somewhere with this, I promise. And ultimately, this led us to what we have now in the medical world, which is vagus nerve stimulation through an implanted stimulator, right, in your neck, essentially, that stimulates the vagus nerve all the time. So microcurrent has shown promise as well in possibly resolving sleep apnea, and it's been doing that again through another implanted device, and it's done a little bit differently. So there is essentially there's a wire that goes to this connected stimulator on your chest, and it connects to the hypoglossal nerve. And then it goes from there to the chest. And realistically, what I think it's trying to do is it's looking at um, sensing that your breathing is stopped and zapping you on that nerve to trigger the breathing again. So I've been kind of working with a few people with this approach, and we're starting to see some good results here. So let me explain how we would mimic that without surgery, because that, of course, is the goal. So there are many methods for stimulating the upper airway muscles, which essentially would be what cause us to not be able to take in that breath, right? But the most effective one I found is to stimulate that hypoglossal nerve. And for those of you who do not know what the hypoglossal nerve is, you will be forgiven because I definitely was not aware of exactly what it did, and we've never talked about it before. So the hypoglossal nerve, I unfortunately can't draw on this slide, but it's the nerve that's kind of more on the face right there, right? You can see it. It's the one connected to the muscles on the bulk of that image. And you can see that it goes up there towards the brain. So what you really want to do here is we want to stimulate this nerve. And what we've been working with is brief stimulation before you plan on going to sleep. So what I like to do for this is use blue stimulation. It's an easy to use program. Everybody has blue stimulation in all of their microcurrent devices. And what you're going to do is you're going to place the electrode right on the hypoglossal nerve, and you're going to stimulate this for 2 minutes per side before you go to sleep. Now, you could use the device, you could use the Y electrode, it doesn't really matter. But you're going to be doing this because the nerve there is giving access to muscles that can stimulate appropriate breathing action. So, making sure that this nerve is awake and working is the key, I think, to helping work to resolve sleep apnea. So, just to show you without the image, just to make it easier to see on me, I'll get rid of the image for a second there. I would set my device to blue stimulation, and then you'd be looking right around this area here, right? Because that's kind of where you can guarantee the electricity is going to enter that nerve. I wouldn't worry about being too accurate because the electricity is dispersing through the tissue and it's going to connect with that nerve. So, stimulating for just 2 minutes at a comfortable power level so that you can feel it, right? So, you're adjusting it up so you can feel it, and you're just going to leave it for the 2 minutes, stimulating, keeping it comfortable. Once you've done that, you switch and you do it on the other side as well. Then you can go to sleep. Make sure that power level is comfortable. So the other thing you can do if you want to take the more like traditional approach we've been using for a while is to use 7 to 12 hertz, which is a different program, right? And actually work on the neck and throat muscles, avoiding the thyroid as best you can. But the goal is to build up and strengthen the muscle tissue because typically, again, like as per the symptoms, it's relaxing so much that the breathing can stop. So if you can strengthen those so that they tone a little bit better, then you're less likely to slip into that state. This will really help to repair the muscles. There's no need to use an anti-inflammatory. So if you have a pinnacle, I wouldn't recommend using the Sanabio 14 because it's going to remove inflammation, which sleep apnea does not really have much of an association with. So you could use 7 to 12, or you could go in and you could use a program into your device directly, that 13.6 hertz frequency. So ultimately, these are the two kind of basic treatment approaches that have proven to have some good effect. But looking at that hypoglossal nerve, and I'll throw that back up on the screen just so you don't have to rewatch the video. Looking at that hypoglossal nerve seems to be the key that we're missing in working to resolve this. And this is where I think we need to be pushing things moving forward. So hopefully that helped everyone understand a little bit more about sleep apnea and what approaches we might be able to take to work on it. But that about wraps up today's training. So thank you so much for joining me today. I look forward to seeing you next week for another Monday 10-minute training. Take care. Bye-bye.